Hi, everyone. I'm Steph, and this is Lisa. And with Jenny, we are PD Connect. We're very excited to have Dr. Daniel Corcos here today with us. I'm going to do a tiny intro and then let him have the stage here. All right. Dr. Daniel Corcos obtained his PhD in 1982 in motor control from the University of Oregon. He is currently a tenured full professor at Northwestern University. He has published more than 200 peer-reviewed research articles, and his research has been cited more than 13,000 times. That's a lot. He's been awarded more than $40 million in grant funding. He was selected for membership in the National Academy of Kinesiology in 2001 and was made an honorary member of the American Physical Therapy Association in 2018. He has completed a clinical trial on the effects of progressive resistance exercise in Parkinson's disease that demonstrated clear benefits on the motor symptoms of the disease, as well as benefits of exercise on cognition. He has published multiple papers that were voted Paper of the Year. He was the co-principal investigator on a phase 2 clinical trial on the effects of different doses of endurance exercise on patients with Parkinson's disease. The paper that resulted from this trial showed that high intensity endurance exercise slows down the rate at which Parkinson's disease progresses. The paper was published in the Journal of the American Medical Association Neurology. The findings have been covered in the New York Times and the general press worldwide. He is currently the PI of a follow-up phase 3 clinical trial on endurance exercise, Sparks 3. Thank you for joining us today, and here he is.
Well, thank you for that very, very kind and generous introduction. Today, I'm going to be talking to you. Somebody has a raised hand. So today, I'm going to be talking to you about Parkinson's disease exercise prescription. So it's axiomatic exercise is beneficial. The exercise cure, this was on the front page of Time a couple of years ago. A lot of my friends use this as a screensaver just to remind them how therapeutically beneficial exercise is for everybody, not just whether you have Parkinson's disease, it's good for everybody. Now, we know what the problem is with exercise, and Oscar Wilde is not alone when he wrote, "To get back my youth, I would do anything in the world except take exercise, get up early, or be respectable." And so people do find it hard to exercise. And what I hope to do today is to persuade you that the evidence is so overwhelming that you have to find ways to exercise, even when it's perhaps not the easiest thing for you to do. So those of you who have Parkinson's disease, you know this, especially if you've had the disease for a while. One has a progression of disability. On the y-axis, we have the degree of disability, and then ultimately over here, we have death. It's very important to point out, life expectancy of people with Parkinson's disease is no different to healthy individuals. The issue here is to try to do whatever we can to reduce the progression of disability. So in the prodromal early phase, before one's diagnosed, there's REM sleep behavior, depression, anxiety, hyposmia, constipation. You then have the onsets of symptoms. At some point, you would have been given a diagnosis of Parkinson's disease, but you would have suspected something may not be quite right for a time period beforehand. The diagnosis is made predominantly on bradykinesia, along with rigidity and tremor. And then over time, we have reduced muscle strength, we have reduced oxygen uptake, we have freezing of gait, postural instability disorder, and falls. And as many of you will know, we also have a lot of non-motor issues. So we have fatigue, mild cognitive impairment is a big deal. I had a question about apathy, which I will get to. Orthostatic hypertension is a problem, leading to dementia. And in some ways, this is it's different, but certainly everybody who's getting older also has progression, and many people end up with dementia. So what I'm telling you really applies to everybody in terms of what is best practice to delaying the rate at which one declines. So what is the solution? Well, the solution here is the exercise pyramid. So on the bottom, and somebody asked, whether it really matters if one's doing very intense exercise. I will tell you this many times, it's all good for you. I'm going to tell you what the best prescription is, but have no doubt, this is all good for you. And so focused breathing, progressive muscle relaxation, meditation is very good for you. One of you asked a question about tremor. I'll get back to you about that. But this would be very, very good for tremor. So low intensity, stretching, slow movement to music, slow walking, yoga. And we go up the kind of intensity chain. And then there are at least 4 and many other ways of doing high intensity. You can have fast walking with an incline. You can be running. I know the problems with running. You can be cycling. I'm going to talk to you about rowing. And here we have a schematic of a person's heart rate over about 40 minutes. And one of the questions was about how do you know how hard you're pushing yourself? Well, a heart rate monitor is the way to titrate the dose. So here we have the heart rate, and you can see that this person is then putting intervals on top of a steady state elevated heart rate. So there are all kinds of ways you can do this. One of you asked a question about safety. Well, safety is a big deal, and I'll talk about it more at the end. But if you look at activities like rowing, when you're sitting down on a rowing machine, well, that's going to be very safe. You're not out walking, you're not cycling in traffic. It's a very safe activity. And so there are many ways to do high intensity, and we can talk about different ways. So I've got 4 objectives, and by the time that I finish talking today, I want you to take away 4 messages. Some of the detail you won't remember. I just want you to remember 4. 1, overall activity level is important. There's no question, and we'll talk a lot about intensity, but overall activity. I'm going to explain to you that there's clear evidence that working out with weights is beneficial. Weight training is good. Endurance exercise is beneficial, and there's the best evidence that it may delay the rate at which the disease progresses. And the elderly fall, people with Parkinson's disease fall, and so balance exercises and activity that benefit postural stability are good. So these 4 are the cornerstone of what is very important to internalize, and by internalizing it, to persuade yourself that it's good for me. And if it's good for you, it's good for the people around you as well. Now, some people need a little bit of motivating, and some people find devices nice and motivating. So you can get a Fitbit, you can get an Apple Watch, you can actually monitor what you're doing. And so in terms of keeping activity level high, that is very important. And it's a very motivating way to keep activity level high. But you want to be very, very careful, because these are very, very nice, shiny devices. And as my friend found out, when you leave your shiny device around, when you leave your shiny device around, your friendly dog may get it. So just be careful, but activity monitors are very good. Now, we've known since the times of the ancient Greeks, and actually beforehand, you can go and read the literature in India 6,000 years ago. People have known activity is good, and lack of activity destroys the good condition of every human being while movement and methodical physical exercise save it and preserve it. So we've known it for a long time. What we haven't really had is the evidence base. Now, when I'm giving lecture to my Doctor of Physical Therapy students, and I certainly enjoy teaching my Doctor of Physical Therapy students, I show them this figure and I ask them a very simple question. The question is, how many of you do weight training? And then I ask the question, how many of you do not? And when they put their hands up, I ask them another simple question. If it's good enough for the squirrel, why isn't it good enough for you? So remember, resistance exercise is very good for you. So one reason it's very good, if you look at this graph here, we're plotting here the maximum voluntary contraction force. Another way of looking at it, this is how strong you are. And you'll see people in their 20s, 30s, 40s, 50s. People are pretty strong. And then what happens, mid-60s onwards, two things happen. You can either look at the glass half empty and you have this decline going on. So by the time this person's in his 80s or her 80s, they've lost a lot of strength. And these people end up being frail. And the next step after frailty is mortality. But these people are not losing their strength. And so at the end of the day, we all have the question to ask, because I happen to be 66. So I'm at this threshold point. And I ask myself a simple question. Do I want to go this way? Or do I want to go that way? And that's what you need to ask yourself. So I published a study, Progressive Resistance Exercise Training Study, the PRET study, and we had people go into a gym and work out using either a progressive resistance exercise training program or Fitness Counts. Fitness Counts is an exercise program written by a PT. You will see it online. It's good. It works on non-progressive flexibility, strengthening, and balance. It's done with our intervention was over a 24-month exercise period. And when a person sees a neurologist, they are assessed with their degree of Parkinsonism by the Unified Parkinson's Disease Rating Scale. And that's the test we use as our primary dependent measure. And we assess people when they're in the practically defined off. The reason we do that is that gives us our clearest assessment of how Parkinsonian a person is. I just want to check something, Lisa. The people entering the waiting room, and I have the button to admit. Should I admit people?
Yes, sure. It seems like there may be an issue about admitting more than 100, but go ahead. Let's see what happens.
Okay, I've pressed that button. I'm now going to keep on talking. Have you all managed to hear so far?
Yes.
Yes.
And am I going too fast or too slow?
Just right.
Just right. Okay, so patients were randomized to PRET or Fitness Counts. They had a personal trainer at a local gym. Not as good as Lisa, but they were okay. And then they were instructed to administer the program and informed the patient group assignment that neither the personal trainer nor patient was aware of the study hypothesis. The exercise was over 24 months. It was twice a week, 90 minutes per session. We encouraged no other form of exercise because it was a scientific research study. Twice a week with a personal trainer for 6 months, 7 to 24 months with a personal trainer once weekly with instructions to continue the twice weekly regimen. I'm going to walk you through the 11 exercises. They were increasing resistances tolerated for all the major muscle groups, axial, upper and lower extremity. So here's the book, Fitness Counts. And this was stretches, non-progressive strengthening, breathing and balance, same at each session. It doesn't have to be these 11 exercises. There's nothing magical about them. They are whole body, but I want you to see both of the people taking part here that we have pictures of. They were getting stronger, and that's the point. to really work the muscle, because by working the muscle, you work the brain. So here are 4 more. And then here are 3 more, and they're all discussed in detail in the 2013 publication in the journal Movement Disorders. So here's the data. If you look at this point, over 24 months, an average person with Parkinson's disease will get about 6 points worse when they're assessed. Modified fitness counts have a big change at 6 months, because these people weren't doing anything and they go to doing something. They return to baseline, they're still better. And then the weight training group were 6-7 points better than fitness counts, and they were 13 points better than a control group, or at least when you go to the literature and you see what natural disease progression would be. Now, this is also very important. It's complicated, but the idea is that resistance training is probably the best therapy for improving cognition. It doesn't just benefit the muscle. It works a lot on cognition. And what you see here is a control group who over 12 months didn't change. There was no difference between our 2 treatment groups. Okay, the black and the gray are our 2 treatments, progressive resistance exercise and modified fitness counts. And when you average them, this is your response. There was no difference between the 2, but the average was over 2 points on the digit span sum score. So this paper was voted Paper of the Year in 2015 by the editorial board of movement disorders, because they recognize that the decline in cognition is a big deal. And for many people, it is the non-motor aspects of Parkinson's disease which are as important, if not more so, than the motor. Now, this is some recent work I'm doing with some very talented colleagues in Brazil, and they take these 5 exercises and they work very, very hard on providing an unstable environment. Now, this unstable environment makes the exercises very challenging on the nervous system, because you're getting a lot of information from the muscles which are being stretched. So if you look at that half squat exercise, that is very difficult when you've got instability on your back and you've got instability below your feet. At some level, you end up using very little weight, which can be good if you don't want too much pressure on your muscles, but your brain is having to do a lot of coordination. And what they found was, this is just one small part of the data. If you look over here, this is the Research Training Instability Group, RTIG. And before the study, 9 of 10 people had mild cognitive impairment. And after the study, there were only 2. So below 26, 25 is the cutoff for mild cognitive impairment. And so you can see that this particular exercise protocol was very, very good for cognition. Now, sleep is impaired in people with Parkinson's disease. By the way, it's very clear, no 2 people are the same. So some people may not have a sleep problem, but some really do. There's some excellent work coming out of the lab of Amara, and she published a paper in Movement Disorders. And what you'll see here is, this is the change from baseline to post-intervention. And slow wave sleep is when you have memory consolidation going on. So the slow wave sleep, and you can see that people after the exercise program had better slow wave sleep. So when you're thinking about exercise, and I did get one question, which I really understand very well, and that is, if you're depressed and if you have apathy and you have a lot of other issues, then doing anything is hard. And fully how to overcome that, I don't know. But one possibility is to think through all the benefits So it's not just your heart and it's not just your brain, but your sleep will be better and many other aspects. One of you asked about freezing of gait. I will talk more about freezing of gait later on. If you happen to be working with a physical therapist, then you can certainly refer them to the paper by Batista et al. I'm an author too, so just go in and find the paper, Batista and Corcos, and you'll find that that instability resistance exercise program, we also studied its effect of freezing of gait, and it did improve freezing of gait. It's the best evidence in the literature to date on the benefits of exercise for freezing of gait. So working out with weights twice a week is very therapeutically beneficial. And I would encourage all of you to do it, okay? And just remember, if it's good enough for the squirrel, it's good enough for you. I don't expect many of you to be able to read this. All I want you to see is that I conducted a phase 2 clinical trial. 43 people were studied at 80 to 85% maximum heart rate. 45 were studied at moderate intensity. And then we had a usual care group who after 6 months were randomly assigned to either 80 to 85 or 60 to 65%. And you'll see nearly everybody finished the study. So there's clear evidence here that if you can get motivated, that people with Parkinson's disease can finish a 6-month exercise intervention. The first thing we wanted to know is, can people hit these target heart rates? Well, they can. We gave people plenty of time to get used to it. So we only collected the data from 9 to 26 weeks. And you'll see people can, if they're assigned to work out at 80, they're working out at 81, 82% over time. The 60 to 65% group, they worked out a little bit higher. Most people in that group wanted to work out a little higher than 65%. This figure is very important, okay? We asked people to exercise 4 days a week. They exercise just over 3 days a week, a little bit more in the 60 to 65%. It wasn't statistically significant, but you can see it lines up above the 80 to 85% group. And the thing here is to tell yourself, okay, so look, we're all busy, probably have grandchildren or great-grandchildren we may be looking after. We sometimes get sick. We may have a partner we're looking after. We have a lot of things which mean that if we have a goal of 4 days per week, we may only end up at 3. So if you really want to exercise 4 days a week, probably a good idea, maybe even to set yourself a target of 5 days a week. Just recognize by kind of keeping a diary or a calendar that reasonable things can get in the way of one's exercise program. Now, these are the data, and these data are important, okay? So this is the change at 6 months in the MDS, Movement Disorders Society, UPDRS. The group working out at 80 to 85% hardly progressed at all, 0.3. The 60 to 65% group, 1.8. And those who didn't exercise over 6 months were above 4. You can double that to get to what would happen in a year. So you can clearly see that the high intensity exercise is beneficial. Now, the English, in only the way that the English can, love their headlines. I talked at length to Natalie Rahal for the Daily Mail, and I gave her all the scientific qualifications, but her headline was 3 intense workouts a week could drastically delay Parkinson's symptoms, study finds. That may be slightly overstating it, but there's no question it's very good for you. I'm just going to read you because I get lots of emails from people about how this helps them. I've yet to get an email that it hasn't helped somebody. So, hi, oh, sorry. Hi, Dr. Corcos. I wanted to check in and let you know that I went for my VO2 test this morning. The doctor who performed the test said my maximum heart rate is 166 beats per minute. Based on your research, that means I should be engaging in aerobic exercise at least 3 days per week for 30 consecutive minutes per session at a pace that gets me between 133 BPM and 141 BPM, or 80 to 85% of my maximum heart rate. Is that correct? It most certainly is. I'm also still engaged in weight training at least 3 days per week for an hour per session. My primary goal is to slow the progression of PD. I'll do whatever it takes to keep it in check. As you make new discoveries relating to PD and exercise, I hope you'll add me to your email list and keep me informed. Your work has given me a ton of hope. Many thanks again. We're still in contact. Now, I just want to make it really clear, without many of you understanding very much about this slide, that there is a very deep biology that underlies this. So over here we have the brain of a healthy person. Some of you will have had a dopamine transport SPECT scan. A healthy person, that scan looks like a comma. So you have dopaminergic uptake. It goes from the striate to the caudate and putamen. And so you can see both the caudate and putamen bilaterally active. If one has Parkinson's disease, you don't see that comma. What you see is a bilateral reduction in activation in the caudate and putamen. And that is one way that Parkinson's disease is diagnosed. The actual diagnosis is always clinical, and the DAT scan can be used to help confirm that. And what we're hoping in SPARKS-3 is if a person comes in with a DAT scan like this, to at least maintain it and not have reduced activation. And maybe if we're lucky, it will even start to look a little bit more like this. I think it's unlikely, but that's why we do research. Now, cortisol is a stress hormone. Cortisol is related to cognition. We've shown that endurance exercise downregulates cortisol, which is good. It brings it closer to normal levels. If you ask your physician for a panel of inflammatory markers, you'll certainly have what is called C-reactive protein. I just had that recently done, and it's good to have low levels of C-reactive protein. And there's a lot of evidence that it's elevated in Parkinson's disease and that it can be reduced with exercise, and we'll be studying that. BDNF is brain-derived neurotrophic factor. It's reduced in Parkinson's disease, and it's elevated with exercise. So the evidence that exercise is affecting growth factors, hormones, inflammatory cytokines is compelling. You just get to be basically have a generally fitter, more normal panel profile. So working out 2 to 3 times a week with your heart rate elevated will help improve maximum oxygen uptake, walking economy, multiple parameters of walking, and potentially reduce the rate at which signs of Parkinson's disease progress. Now, postural stability training is very important. The best study to date was published in the New England Journal. It was a clinical trial, and it showed the tailored Tai Chi program reduces balance impairments and decreases falls more than 2 other interventions that were compared. And so I strongly recommend that balance training is part of what you do. If you don't have a postural problem now, the likelihood it's coming. It's also very calming. Many of the doctors I work with are very much into the mind-body relationship, and I think it's very useful. So the best way to improve balance is to do balance activities. Can either incorporate balance into progressive resistance and endurance activities, or do specific exercises or activities for balance. Now, I study those two interventions because they're much more easy to quantify than many other interventions, but I don't want you to think they're the only ones. Aqua aerobics is very, very good. Cycling is great. Rock steady boxing is great. Yoga, physical therapy, occupational therapy, Lee Silverman voice therapy loud, and also LSVT big. It's all great. Now, one of you asked a question about rock steady boxing. So this is probably my favorite slide. It's my favorite slide because what you see here are people who are empowered to take ownership of their disease. They go in and they work out. There's nothing magical about rock steady boxing, okay? But a lot of people like camaraderie, and you can see there are a lot of people here doing it together, and I think that can be very, very motivating. So if you have apathy or depression and a whole group is waiting to see you, then maybe you can find that a little bit motivating to just go there and see your friends or your colleagues or the people you work out with. Now, this came from one of you. I tore my shoulder rotator cuff from a PD boxing class. Why is boxing so popular? I think I've kind of given you a hint why. Also, and this may be true for one or two people, just whacking at a box, so whacking at one of the big boxing things that you hit, I'm blanking on the name for it, or at a partner who's holding out a glove. That just may be cathartic to get out frustration. But if the idea is to move quickly and in different directions, isn't moving quickly and with difficult coordination like pickleball or tennis just as good? And I think the answer is yes. Now, there are never going to be studies comparing A versus B like that. And at the end of the day, you have to do what you enjoy. You have to do what your body will tolerate. Rotator cuff is no fun. And with the help of a good therapist, you can get at the underlying biology of what the intervention is trying to accomplish. So this is the exercise prescription, and we kind of know it pretty well now. Over the last 2 or 3 years, it's become really, really clear. So number one, do what you enjoy or are willing to do to maintain activity. There's study after study, whether it's interventional, whether it's epidemiological, wherever you look, people who do activity have a better quality of life. Weight training, this is the best evidence for symptom improvement. Endurance training is the best evidence from studies on animals for neuroprotection. The idea that you're protecting neurons over time, so you slow down the rate at which they die, so you slow down the rate at which they're producing dopamine, and that's good. Balance training is really good. And then the other thing which is really very important, there are no known detrimental side effects, but do listen to your body, okay? So clearly a torn rotator cuff is a detrimental side effect. And so perhaps some people are not cut out for some types of exercise, but in principle, there are no detrimental side effects. Now, I published a paper in the area of Alzheimer's because it was a review and the work hasn't yet been done in Parkinson's disease, but it's really, really clear that if you have the disease, your partner, caregiver, loved one would also benefit from this. So the idea of a person with a disease exercising alongside a person without a disease, and that's the idea behind the dyadic exercise interventions. Again, these studies are also showing this is very good. It's stressful looking after people, and therefore doing exercise has a significant benefit. Now, I'm going to ask you all 2 questions. It's always much more fun giving this talk to a live audience, and I do hope to be out to California before long, and it'd be lovely to see you all. Now, if you had a dog, would you consider not taking your dog for a walk? And the answer is no. In fact, my clinical coordinator, her name is Liz. Maybe she can confirm that she's actually currently walking her dog as she's listening to me. So if it's good enough for your dog and it's good enough for the squirrel, it's got to be good enough for you. Another question, for those of you who take medication, how often do you not take your medication? Well, if you always take your medication, then shouldn't you always take your exercise pill? Now, for those of you who take part in science, and I think some of you go to UCSF, I'm a very good friend of Dr. Niji Luthra. If you see her, you're in very, very good hands. If you're looking for a really top-notch physician who understands exercise, it would be well worth going to make contact with her. She runs scientific projects. So for those of you who take part in science and research studies, I want to thank you. The science is only as good as the people who take part. And we have people tuning in from not only the wonderful state of California, but certainly from the wonderful state of Pennsylvania, and perhaps from the wonderful state of Illinois, and also from Tennessee. So wherever you're from, do try to help out in research studies. I'm currently PI of Sparks 3. You'll see it if you Google Sparks 3 PD. And if you want to take part, there is a site in California. Now, I intentionally didn't speak for too long because I'm going to try to answer 26 questions, okay? So Lisa, would you rather I went through the 26 questions, or would you rather I take questions from the audience on my talk and now? Which would you prefer?
I think taking the questions that you have is a good way to start, since those people sent them in.
Okay, well, people can interrupt me, or you can text or put in the chat, contact Lisa. So question number 1, okay. I know intensity is important, but if you didn't know it beforehand, you certainly know it now. How is this measured? By heart rate, speed of movement. I can raise my heart rate equally either by walking fast on a flat treadmill or walking slower on a treadmill with an incline. Is one of those better? No, I think one thing about the treadmill is, exercise can get a little bit boring. So, do it flat one day and maybe on a treadmill incline the next day. The important thing is we're trying to get your heart to between 80 and 85% of its maximum for at least 30 minutes, 3 to 4 times a week. That's the key thing. Some exercise is not as intense as my spin or treadmill workout in terms of heart rate or speed, but I'm guessing these other exercise benefit for me. Tai Chi, weightlifting, balance, Pilates, yes. How should I divide my exercise time among intensity and these other types of exercise? If intensity is most important, is it best to do some intense work daily, or is it equally beneficial to have some day with only other forms of exercise? So what I think is, if it was me, it's pretty close to what I actually do. I would do weight training twice a week, and I would do endurance training 3 times a week. And I would either have a special day for Tai Chi or balance. I think dance is terrific. I think for those of you who like to dance, it's wonderful for posture and balance. And that's how I would do it. Now, 6 days a week may be way more than what some of you want. So you can do some endurance and some weight training on the same day. It really just depends how much time you have to invest and how much time you're willing to invest. I work out 4 days a week in PD specific classes, and I don't always sweat, and my heart rate isn't high for the entire time, but I feel the classes are very challenging and my body seems to move better overall. Is that good enough? Well, it's way better than being on the couch. Okay? So whoever sent in the question, the answer to the question is absolutely. Okay? Then I think you have to look at the evidence and you have to ask yourself, are you willing, or do you want to, or is it worth it? And we're all very, very different. For some people, high intensity exercise, it's just not what they were born for. They're in the kind of Oscar Wilde camp. But doing this is really very, very good, because you saw from my study of the weight training study that the group of people who did the modified fitness counts, which is not very demanding, they still did very well. So the take-home message here is to do, the most important thing is to find something you're willing to do for the rest of your life. This isn't for the next week, the next month. This is a complete lifestyle change. And you just have to find where in that scheme you fall. I've answered the PD boxing question. I feel so fatigued during the time that there are PD classes. What does the research show about taking a rest instead of pushing through to attempt exercising? How do you know when rest is becoming apathy? Well, there isn't any real clear research here, okay? Rest is good, okay? So from my point of view, for all of you, that exercise is important, good nutrition is important, sleep is important, and then rest. So it's not good to push yourself too hard. You see this in athletes. So very often the job of a coach is to stop somebody working out too hard. And it's also true for some people with Parkinson's disease. They push themselves too hard. So the really important thing here is to listen to your body. Now, the safety first is a really, really good question, okay? So I'm not going to read this question. So I've got colleagues, we did a study in Colorado, they've done studies in Colorado, and what happens, you get people noticeably fitter, they get confident, they go out in the mountains, they go walking, and they fall and they have an accident. And so at the end of the day, you've got to be careful, but I can tell you for certain that if you want to not fall over and guarantee it, stay in bed. And if you stay in bed, the deconditioning is so terrible for you, it is much, much worse than in fact having some kind of an accident. Now, I think one has to know one's body. If you are posturally unstable and you work with a good PT, they can really help you. You go to the right place. There are not many of these around, but there may be around by you, a place with a treadmill with a harness. And then if you fall, the harness catches you. I put at the beginning, at the top of the intensity spectrum, a rowing machine. You could try rowing because you're right next to the ground. So it takes thought. I'm 73 and was diagnosed with PD 4 years ago. I walk for about 40 to 45 minutes, 5-6 days a week, and usually get my heart rate up to 88 to 90 beats per minute. It's painful for me to run because I've had bilateral hip replacements and bilateral knee arthroplasties. Is the walking adequate for aerobic exercise? So it's adequate, absolutely yes. A little bit like my other question. Is it optimal? No. Now, with hip replacements and knee arthroplasts, one is limited. Cycling, there are all kinds of cycling machines that one can find. And maybe it's worth thinking about cycling to get one's heart rate up a little bit higher. But what you're doing is absolutely terrific, and it's way more than most people do. The other possibility is swimming. One just has to play around with activities which don't put too much stress on one. Is there any benefit to working out during off periods of my drugs? I think there's no evidence, and I would work out in your best medicated state. I should also let you know, because I think some of you don't, I'm a PhD, I'm not a physician. So I'm very careful in my answers. And for some questions, you definitely want to go back and talk to your physician. What exercises are best for tremor? Now, this is really hard. So tremor is hard to treat. It tends to be refractory to medication, but sometimes a person can find a medication that works. There hasn't been much work in exercise for tremor. If you look in the area of essential tremor, which is a different disease, resistance training and hand training may benefit. And so I would try that. This may be a place for yoga and relaxation. There's no question that that stress exacerbates tremor. So anything one can do to reduce stress. Then if the tremor is really bad, I'm not advocating this, it's just my job to tell you this. Deep brain stimulation is tremendous for tremor. If you're going to have deep brain stimulation, go find a top-notch neurologist working with a top-notch neurosurgeon, and then ask for their opinion. But if one is really, really tremor dominant, it's definitely worth considering. Okay, what can I do to help me recognize when I'm not pushing myself as hard as I should be? It feels hard to me already. I know the girls are always saying to be between 6 to 8 exertion. Well, we're back to the heart rate monitor. But again, one of my real frustrations is that the 100 of you or 120 of you I'm talking to are not the ones I should be talking to. It's all of those that are not attending. So the very fact that you're doing anything and the very fact that you have the girls pushing you is terrific. And I think that's about all I can really say. It's terrific. Now, from your professional experience or from your knowledge of Parkinson's research, is there any evidence that playing a musical instrument is highly beneficial for the human brain for Parkinson's disease? So let me tell you 2 things. First of all, Google Elizabeth Stegemoller. She's terrific. She studies Parkinson's disease. She's at Iowa State, and she does music therapy classes for people with Parkinson's disease. And when you go and watch her do musical therapy for people with Parkinson's disease, again, you see people who are very, very animated. That doesn't fully answer your question. I'm not sure of any research about playing a musical instrument. But one way to look at Parkinson's disease is it's a dopamine deficiency. It's targeting a small part of the brain, substantia nigra pars compacta. And so in many ways, people, in nearly every way, a person with Parkinson's disease is no different to any other person. And I think you'll find that there's evidence and certainly strong thinking that as one ages, learning activities like playing a musical instrument is highly beneficial. So I would encourage it. So question number 12, also from your professional experience. Okay, I have no professional experience in this area, or from your knowledge of research. Well, I did a search of the literature done on Parkinson's. Is there any evidence that maintaining an active and satisfying sex life is beneficial for Parkinson patients? Well, this is a paper just published in 2019 by Piccolo, showing that for males, if you look at the UPDRS, this is a 24-month time period. And then this is disease progression. And these are people with Parkinson's disease who on a questionnaire said they were not sexually active, and these people were PD sexually active. Now, this data was for males. Males is more, Parkinson's is more prevalent in males than females. So the survey was much larger for males than females. In females, they did not find this relationship. And that probably because the study didn't have enough participants to get statistically significant results. These studies are always hard to interpret because what you see here, that the PD sexually active, they have a lower score to begin with. So whether it's sexual activity or whether it's that they had a lower score to begin with, the data is always hard to interpret. But if you kind of look at the literature in general, I think there's a feeling that an emotionally satisfying relationship or satisfying sex life is beneficial to people. If during exercise, a Parkinson patient is not able to reach a high level of intensity with the exercise, is there still benefit to performing that particular exercise? Absolutely. Okay. Anything is way, way better than nothing. I'm riding my Peloton bike once a day. How much time at 70 to 90 RPM should I ride? If my ideal heart rate is 100 to 110, I'm 77 years old. How much time at how many RPM should I ride? Is it better to ride fast for a period of time and then ride slow, 1 minute fast? How many days a week should I do this? So this is a great question. The research is not sufficiently defined for this, okay, to give you a clear answer. I think if it was me on the Peloton bike, I would probably do 2 days a week at the 80 to 85% for at least 30 minutes. And if you can do the higher cadence closer to 90, that'd be good, but 70 will work as well. I know Dr. Alberts talked to you, and there is evidence that the higher cadence can be beneficial, but I think both are going to benefit you. And then if on a couple of your sessions, you want to go a little bit higher than that, to start off a little bit lower and kind of do some intervals. And if you enjoy that, 1 minute fast, 30 seconds slow, like interval training, I enjoy that, and that's what I do. But again, we're not going to have the literature on that, but you're basically, this is going to be terrific for you. Now, this is a good question. How much exercise is okay to do if you have congestive heart failure? So I strongly recommend that you find a really good cardiologist, find one who really understands sports medicine, and you're going to get a double benefit here. Clearly, you have to deal with your congestive heart failure, because the heart failure means you're not pumping blood and efficiently, and that may well mean that your neurons are not getting sufficient oxygenation, etc. But I think with congestive heart failure, you have to be careful. If you haven't had a stress test, you might want to have a stress test and then get a prescription from a cardiologist as to exactly what you're able to do, and then see how you advance. That's a great question, okay? Whoever can get the drug to give you the benefit of exercise without doing it is going to be a zillionaire, okay? So we're all looking for the exercise pill. And so the answer is no, okay? Now, in a few years, you'll be surprised what comes out. There's a study in Science in 2020. If any of you are scientists or any of you like reading Wow Science, it's really, really clever. So the idea is you take a rat, you put it on a treadmill, and you give it high intensity endurance exercise. You draw its blood, you inject it into a rat that hasn't exercised, and lo and behold, the brain-derived neurotrophic factor is elevated. Now you can see from all the work that has been done with athletes and doping that this is kind of blood doping, and it could well come sometime. The problem is when you do that, are you getting all the benefits? Because it's much more than just the changes in the blood that you're altering. So I think at the end of the day, you just got to exercise. This is a really, really good question. I'll come back and answer it. I'll tell you what, I'm happy to stay on for a while, but I think at this point, I tried to keep my talk short so I could answer many of the questions. I think I'm going to stop for the moment and then see how you want to proceed from now, Lisa. So I'm happy keeping going. Or I'm happy taking new questions. I'm happy coming back and doing the other 8 questions another day.
Excellent. Well, we're happy to keep going right now. So we can take a few questions from the audience. There's some questions in the chat, so if you guys can remain muted so that we can read these questions first, that way, can you see them, Doctor?
In the chat, yes, I got 13 in the chat.
Okay.
First of all, right now I can see Samantha and Mardine and Frank and Lucretia and Anne and Ruth and Michael and Elaine. Hello.
They're muted. They're waving at you.
Okay.
All right.
So how many reps are optimal during resistance training and how rapidly should they be completed? I don't know about optimal, but for me, 3 times 10, and not too fast and not too slow, but at a reasonable speed. I'm on Metropolo, which slows my heart rate. So how do I adjust the 80 to 85 max % recommendation? Okay, I assume but don't know that that's a beta blocker. Okay, so one way you do it is you go to an exercise physiology lab or cardiologist and you have a VO2 peak test on your beta blocker. That will give you your max heart rate on your beta blocker. And then you take 80 to 85% of that. You can't use formulae at all. The second way, which is not as good, and so my job is to give you the best science. I understand that we're all limited by access and finances and lots of other reasons. The other way is perceived effort, and you should be 7 to 8 out of 10. This is quite hard in terms of what it's called RPE, rate of perceived effort. Well, the next one is from Joan, which is just a thank you. So I'll take it. Anytime chats come in which thank me. Yes, and also he says thanks to Lisa for hosting. Yes, amen to Lisa. I'm wondering if there I'm not sure I'm picking up. Oh, I started at the wrong point. A hearing background. Okay, Tom, my resting heart rate is 46. What is the optimum max rate? You can't do it from resting heart rate. It has to go from max, okay? If your resting heart rate is 46, you're in great shape, okay? Unless it's pathological. You're in almost good enough shape that if you go to an emergency room, the doctor is gonna ask, is it pathology, okay? So you just say, no, I'm just in good shape. But you gotta work from the max. So you need to either go to a formula. So the way you get your max is one of threefold. One, you just push yourself very hard, but you've got to be in good enough shape to know you can do that. You can't do that the first time you go out. So if any of you are listening to me the first time, don't do this, okay? This would not be smart. But if you've been doing this a long time, you then get your own max. You can use formulae, but they are for the average person, and you're all individuals. Thirdly, you go and have a peak test, and there are going to be many places in California. And if you need any help, we understand California very well because UCSF is a site for Sparks 3, and you will get a VO2 peak. And we can put you in contact with the people who do those tests. And so if you can get into anywhere near UCSF, you can certainly have that done. In addition to PD, I have atrial fib over 20 years. I have tried multiple times to fix it. It puts a real limitation for high intensive exercise. I also have a pacemaker. Suggestions. I have no suggestions, but I do think so. I have a little. Okay, so for those of you with the heart issues, I empathize. I'm fine. Don't worry what I tell you next. I'm not going anywhere in the near future. My cardiologist can't decide whether I've got a heart problem or whether I've got athlete's heart. I think I've got athlete's heart. They think I've got a heart problem. So you've got to find a really good cardiologist who understands you, and especially an exercise one, and see what they can do for your atrial fib, okay? And only a really good cardiologist can deal with that. And I wouldn't want to go near it. I'm a PhD who knows, my biggest strength is I know exactly what I don't know. And this is not my area. So find a great cardiologist, and you're going to have them. Somebody's maybe putting a movement disorders online. Will all attendees have access to the material? I'm quite sure Lisa, and also Lisa, who's next to you again?
I am Steph.
Hi, Steph. I'm sure Lisa and Steph, and you can send them questions, and then maybe, we can do another one of these at some point. And for home use, what is the overall best equipment, like stationary bike or rowing machine for everyday workout? I think, by the way, I get no money for anything. So whatever I say is completely independent. I think at the moment, if I had Parkinson's disease, I might well, if I had the money, I might well go for, well, first of all, if I was living where you are, I would be with Lisa and Steph. But if you're a distance away, like Pennsylvania, 2,000 plus miles, it's hard currently to argue with a Peloton. They provide motivating music, and rhythm and music is great if you have a disease or if you don't. They're starting to have exercises where you've got small light dumbbells as well. They have engaging instructors. Somebody's asking about a TheraCycle versus an exercise bike. At some level, they're all individual differences. Yep, so there was another thanks. I'm going to go back to my talk because I have one slide that's very important, but I didn't show. So let me see if I can find it. Oh yeah, hang on a minute. I need to share my screen again. So I just want to let you know, I understand it's COVID-19, and for many people, money is very difficult. It's a very difficult time for a lot of people, but I think any group which can get 100 people on a Zoom call has to be doing something right. And my guess is that PD Connect is doing an immense amount right. And running any organization is always financially challenging. So if any of you are in the position that you can support PD Connect in any way, certainly like to at least encourage you. And then I would like to thank you all very much for your attention. But I'm happy taking a few more questions if there's still a few more. I know it's early in California. I also want to say hi to my friends in Pennsylvania. So one of them is a student I taught. So if you could let us know if you're on, and one of the people from Pennsylvania is a colleague who's running Sparks 3. If she happens to be on, if you can let us know. and if my student's uncle is on, be nice to know. So do we have any more questions that anybody has thought of?
Yeah, you guys can unmute now and ask any questions if you'd like to. We are still recording. And thank you so much. By the way, guys, we didn't tell him to plug us, so we really appreciate that. Thank you. That was really sweet of you, and a wonderful talk. So go ahead and ask some questions. Go ahead, you guys.
I have a
Well,
question.
this is, hang on a minute, real quickly. So Megan Tashner is on. So hi, Megan in Pennsylvania. Is your uncle on? She'll just message me in the chat. Okay, so who had the next question?
I have a question.
I have one. Could you talk about tandem bike riding?
Yes, I could. I mean, what do you want to know about tandem bike riding?
It's wonderful in California because there's a lot of elevation gain. And have you used any of that in any of your studies? Looked at the impact of tandem bike riding?
No, I haven't. But it is terrific. You know, first of all, you're out there with somebody else. Secondly, because you're with somebody else, you can kind of work at whatever rate you can, okay?
If the captain listens.
I'm sorry?
You need a captain that listens, right?
Well, Elaine, if you can't find a captain who listens, I'm quite sure on the audience, we can find you a captain to listen.
I have a good captain.
You have a good captain. Okay, in that case, we will leave you in the hands of your good captain. I think it is terrific. I mean, you're outdoors. If you go to England, there's a lot of work going on the effects of being out in a green environment. I mean, you are in some of the most beautiful landscape in the world.
Right.
The weather is pretty good most of the year round. I can think of a few things better. So you were certainly talked about, you certainly had Jay Alberts talk to you, and he's done much of the seminal work. He's the person who did the Ragbri ride over Iowa. So I would encourage, you know, you just got to keep your captain going.
I have a
Any more
question.
questions?
I have a question.
Yes,
Great.
I have a question about the amount of food that you should have before a workout. Do you
The
eat
amount of,
lightly?
I'm sorry?
Do you eat lightly, or do you no fats, or what is there? Is there any guideline regarding consumption of
Okay, so if you'd like, I can get you somebody to do an hour talk on this. I can give you a layperson's answer, but I work very closely with a nutrition expert who's actually taught her, and her dad has Parkinson's disease now, so she's learned the new. So there are two questions here. One, you know, all of you who have the disease, to work with a good nutritionist is important, okay? Because the metabolism of levodopa carbidopa is a little complicated. And so just eating anything is not a good idea. And so you need strong, sound nutritional advice. Secondly, we're all very different. So when I go out riding with my friends in the morning, I need food in my stomach. Some of them don't. Third, you need to know how long you're working out for. If you're not working out for too long, you can get away without having any food, especially first thing in the morning, and maybe you can't take any food in your stomach. But one thing to do is you can experiment. Now, I had some questions coming in about sweating and not being able to sweat, and also to do with blood pressure, which is all kind of diet related. So the most important thing for you all to do is to hydrate, 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 and hydrate, okay? The autonomic system is severe. It can be quite impaired in Parkinson's disease. So you do need to be hydrating. At least one of you has progressive supranuclear palsy, which is also has autonomic issues. So the really reason I'm not answering your question is because there are a lot of individual differences. It also, to be honest, it depends what you do. I can speak for myself. I don't eat before I run, but I can eat before I cycle. It just depends on how you take to the activity. But if the activity is of any length of time, you do need to make sure that you have sufficient nutrition. And what's perhaps equally important, and I'm sure Lisa and Steph can give you all kinds of guidelines, is eating afterwards. So remember, the point of weight training is to break down muscle. So you're breaking down protein. So to have many grams of protein within 30, 60 minutes after you do weight training is really good. And also, you know, as one ages, one does lose muscle bulk. So having taking in protein is really good. And if you are losing muscle bulk, it's all the more important to take in protein. But I think what you would really benefit from, because you're a very nice, smart, and educated crowd, is to have a nutritionist who really understands Parkinson's disease, who can walk you through the best combination of fats, carbohydrates, and protein, both from a medication point of view, an exercise point of view, a type of exercise point of view. And, you know, I can certainly join in. But at the end of the day, there's a lot to be said to listen to your body. And if you're low on energy, then you need to take something to give you some energy.
Great. So Dr. Corcos, Kathy M. and then Sandy Bremner also had questions to ask you. Go ahead, Kathy.
Okay, we'll do Kathy M and then we'll do Sandy B.
I'm Kathy.
Hi, Kathy.
My question is, I worked with a trainer who himself had Parkinson's for 2 years using a TRX strap. So I did a lot of balance work. My question is, when this pandemic came and we were shut down, I haven't left my house in a year, for 10, 11 months. And I felt my little exercise regime fell apart. My question is, can I get it back? Can I get back some of what I lost?
Oh, there's no question now whether you can get back to 100%. So no, I think you have the name Kathy with a K. My wife is Kathy with a K. So I think you can get back to 100%. But even if you only get back to 95%, it'll take time. Don't start off too fast. But I think, so let me ask Lisa and Steph a question. Do you have Zoom classes?
Yes, we're on Monday through Saturday now, and people actually join us from Pennsylvania, which is crazy. So we're reaching some people internationally as well. So we'd love anyone to join us. We have 2 people all the time, one of us seated for modified exercise and one of us standing for higher intensity. So anyone is welcome to come to our classes.
So I want to be careful what I say next, Kathy. I'm a big fan of Lisa and Steph. You should go to their programs because that's something you can do at home, okay? If they're not offering quite the program you want, email them. Lisa and Steph, email me, and I will tell about another program. My job here is not to talk about other programs, okay? Hopefully you'll be able to offer Kathy exactly what Kathy wants, okay?
Yep.
But there's lots of people going online, and have no doubt, Kathy, that if that benefited you for 2 years, you can get it back, and you just have to find a way to do it in your home. Where do you live?
San Francisco.
Okay. I think Sandy had a question.
Yes,
Thank
hello. Thank you for all the information you've given us. I looked up your Sparks 3 PD trial, and my question is, if one wants to participate in that, do we have to give up Lisa's and Steph's class? Not if it's, and give up the exercise programs that we've been doing?
Now, that is a good question. Okay, so if they have you on a treadmill 3 to 4 times a week, 30 minutes at 80 to 85%, the answer is yes, and you might not be deemed eligible. Okay. And I can get my clinical coordinator, Liz, if you're still on, she can help address the question. If it's doing light exercise, so we're at the point in doing studies where we're not going to stop people doing other activity, but it can't be. So if you're doing some weight training, that's okay. You'll find that if you do enter the Sparks study, are you working out with them in their gym or at home?
I work out at home with Steph, on Zoom with Steph and Lisa, and I work out outside at a boot camp 45 minutes, 5 days a week.
You're probably doing too much, but you could certainly call UCSF and see.
Okay.
The reason being that if you're doing that much, then the likelihood of us being able to see a change in you is not that great, because you are doing what we're trying to study. So I think and I must admit, you are looking terrific. So I think the likelihood of you being eligible at the moment is not great, but I think there they can screen you, they can talk to you specifically about what you're doing.
Okay, and the other part of the question is, the treadmill, does your study provide the treadmill, or do you go somewhere to use treadmills at UCSF, for instance?
It will be decided by you and the site.
Oh, okay.
We can provide a treadmill. So for example, if a person is a long way from an exercise facility, there is much to be said for exercising at an exercise facility, okay? I'm not going to walk you through all the reasons, but there's much to be said. Trust me, I'm acutely aware of COVID-19. I fully believe in practicing absolute best health medical practice. And the site will work with you to decide what's best. We also realize that traveling a long way is not conducive to doing exercise regularly. And so we have the ability, in fact, you, the taxpayer, you'll be providing your own treadmill, because I'm funded by, in fact, all of you. So thank you all.
Thank you.
I think, Sheila, do you have a question?
I have a question. So are there exercises that you recommend to get your heart rate up? Because I have fog and I can no longer run or jump, or I lose my balance really easily. So I used to do a lot of cardio, but now it's really hard. Are there other exercises that can get my heart rate up? I find that walking doesn't really do it.
Have you ever tried a rowing machine?
No.
Well, I decided this winter to try a rowing machine. I'd been cycling a lot and I needed some cross training. So I put in over 7,000 miles, and I decided that my body I was losing all my upper body, any shape that I ever had. It was all going into my legs. So I decided, let's do a little bit of rowing. And I love it. So
That gets your heart rate up as well?
Yes.
It's full body. Okay.
It's full body. So if you look at people when they're rowing, I mean, if you look at elite rowers, they are amongst the fittest athletes out there. Rowers, elite cyclists, and elite Nordic ski people, they've all got the highest VO2 maxes. You'll find that you can exhaust yourself on a rowing machine. Now, it'll take you a little while to learn the technique. You probably want to, now, Lisa, do you use rowing machines?
We don't at the moment have access to any rowing machines, but anything is possible. And
well, this is a perfect example for a nice donation for a nice rowing machine. If somebody could donate to Lisa and Steph a nice rowing machine. One of the nice things about the rowing machines is a beautiful online community. So what you find right now with Peloton, you have an online community. You get on a bicycle, you can have a big online community. There are whole groups of people with Parkinson's disease cycling together. There's a group up in Canada who've been organizing this. You just need some software. And for those of you who've got technologically savvy grandkids, they can set this all up for you. And then you can go and cycle with your friends. The rowing community is terrific. It's an online community. I'm sure Lisa can find ways to help with that. And I can put you in contact with my Canadian friends who've got the Swift cycling.
Oh,
So
love that.
yeah, we'd love that. So we're actually working on a newer project. For those of you who are new to PD Connect, we are virtually only right now, Mondays through Saturdays. So we take Sundays off. But you know, as things start opening up here in California, we are actually going to do more stuff outdoors, especially as the weather's been so nice lately. So we're going to be coming to an area near you. I can't say we'll be in Pennsylvania next week, but as things, we'll be in the Bay Area and beyond, and we'll be bringing equipment to you. Of course, you know, making sure we're going along with the safety guidelines, wearing masks and whatnot, as we're both getting our shots this week. So we're very excited and hope that you guys are able to do the same. But yeah, we are making our way back to in-person sessions as soon as we can, as soon as we can be safe and of course socially distanced, but we will still remain live streaming as well. So we'll be in person and live streaming at the same time. If you want to know more about it, guys, it's going to be fun. So we're excited to see, to see all of our people again. It's going to be great. So,
And we love equipment, and we do want to be purchasing some new equipment and additional equipment so that we can offer all of these wonderful things that Dr. Corcos has talked about to all of you.
including our tandem bike project that we've already done.
Yes.
So bringing that to you guys on location will be really rad. San Francisco, we're in Marin County, and places beyond. So anyway, we'll keep you guys posted on all of that stuff. That's something that we're working on very diligently as we are going stir crazy as well. So excellent. So thank you, Dr. Corcos. Any other questions, you guys? Nobody.
Right.
Okay.
Well, thank you once more for inviting me. I hope to be out in the Bay Area, probably in the fall. Well, let's hope I get a chance to see at least a couple of you then. And look after yourselves.
Thank you so much. That was
So
really
much.
helpful.
Yes,
Yes.
thank you.
So much.
Thank you very much.
Thank you so much.
Very good to hear and see
Thank
you.
you. Fabulous.
It was a wonderful
Okay.
talk.
Bye-bye,
Thank you.
everybody.
Bye.
Bye.
Thank
Bye-bye.
you.
Bye, you guys. Thank you.